Let's talk about the gross anatomy of bone. This picture shows the microscopic internal structure, but we're not going to worry about that until a separate set of slides. First, we're going to talk about the basic big parts of bones. So the outside layer of bone itself is compact bone. Now, if you were to just go into somebody's body and open them up and look at their bones, you wouldn't see compact bone first. There's a connective tissue layer on top of it that's superficial to that, called the periosteum, that is integral to the functioning of the bone, but it is not actually bone. So if I ever ask you a question, what is the superficial most layer of bone tissue? It's compact bone. This is a very dense outer superficial layer of bone. And again, it's surrounded by periosteum on the outside. Periosteum, as we'll talk about, has two layers to it. There's a fibrous and a cellular layer. The fibrous is thick and tough and fibrous. And the cellular layer is just one cell thick. That one cell thick of periosteum will go into the middle and line the spongy bone in the epiphyses, or the, the medullary cavity, the open, hollow, marrow-filled cavity of long bones. So the outside is periosteum, the endosteum is on the inside. The periosteum has two layers. I mentioned this. The outer fibrous layer, which is dense irregular connective tissue. I hope by now you've realized that I have a thing for asking about tissues, so you might want to learn that. And the inner layer is called the osteogenic layer, which is made up of bone stem cells. This is one cell layer thick. Now, your bone has a blood supply to it. It's living tissue. So that means that blood vessels are going to have to get into the bone. They're going to go through in their own special channels. And when they do go in their own special channels, this inner layer, this osteogenic layer, the cellular layer of the periosteum, will follow the lining of those blood vessel canals. And once they get all the way through, they'll line the inside. The periosteum is really super important. It's not something that we often think about when we talk about bone. We usually do sort of think about bone tissue as its own sort of thing. We also usually think about bone as if it's like a dead rock inside of our body. It's hard to sometimes remember that bone is every bit as living and changeable and dynamic as any other tissue in your body. Because bone has to continually grow, lay down new tissue, and repair itself and break down tissue, it needs a lot of energy. And in order to get a lot of energy, it needs to have good access to the blood supply. The periosteum, particularly the fibrous outer layer, is very richly innervated and very richly vascular. The bone does have nerve endings in it, but the periosteum has lots of nerve endings, in particular a lot of the types of nerve endings that will register pain. So when you break your leg, for example, you fracture your leg, when the bone breaks, it's going to sever the periosteum. And when the periosteum nerve endings get damaged, or they detect that damage, that's what's going to hurt. Blood vessels will pass from this outer fibrous layer, like you can see one here, and pass into bone, into these networks of canals that intersect with one another. We'll talk more about what these really are when we talk about the microscopic anatomy. But eventually, as a blood vessel, and I'm going to make this blue even though that's a color for a vein, but it'll stand out this way. As that blood vessel penetrates, it'll go through these different layers and ultimately be able to feed lots of bone tissue. When it reaches the inside, this medullary cavity, the inside hollow part of the bones, it'll be able to nourish the bone marrow. Yellow bone marrow, which is mostly fat, still does stuff. It still has some metabolic function, so it still needs access to the bloodstream. And red marrow, I mean, that has red in it, right? It's got to need a lot of blood. It makes blood cells, so you're really going to want to have access to the bloodstream there. The holes on the outside of the bone that these blood vessels enter through are called nutrient foramina. From lab, hopefully you've recognized that foramen means whole, and nutrient, you know what nutrient means. It's for nourishment. The periosteum is attached to the bone underneath by way of special fibers. They're collagen fibers. Sorry, I have a notification up here that I can't make go away. There we go. That are made up of collagen called perforating fibers. These perforating fibers are created in the outer fibrous layer of the periosteum. They pass through the cellular layer and they anchor themselves to the bone underneath it. Where the bone becomes thicker, where the muscle is pulling on the bone more, you're going to find more of these perforating fibers. You'll also see these be called Sharpie's fibers. In textbooks, you're free to write that term if you want to, but I'll be using perforating fibers since it's the more descriptive term. So, since the periosteum is on the outside of your bone, muscle is really attaching to periosteum, which in turn is attached to bone. So when your muscle contracts and pulls on a bone, it's going to tug at the periosteum. If the periosteum is being tugged away from the bone extra much, it's going to want to lay down extra fibers to keep it from actually separating from the bone. So therefore, you'll find more Sharpie's fibers at those sites. Endosteum, I mentioned, is actually an extension of the inner cellular layer of periosteum. It's a very delicate membrane. It's actually simple squamous. Epithelial tissue. It's a mesothelial tissue. It's one of those simple squamous situations where it lines an organ. So the cellular periosteum, the inner layer of the periosteum, is simple squamous. It's made up of mostly bone stem cells and some other types of cells. That is the mesothelium of the bone, basically. It covers the outside of the bone, under the fibrous layer, deep to the fibrous layer, and as I mentioned, it follows through nutrient foramina, paths where blood vessels and nerves enter, and they make their way through the bone and ultimately to the medullary cavity or the red marrow, the endosteum in the epiphyses, and serves to nourish the bone tissue throughout that way. Remember from the tissues that you have trabeculi, which are the archy parts of spongy bone. So when you look at spongy bone, let's take that cross section, what you really see is like a lot of holes of different shapes, right? All this in here is bone. You have these arches of bone. Each of these arches is a trabecula. Trabeculi means arches in Latin, I believe. So the endosteum lines the outside of the bone fairly directly. It's the inner layer of the periosteum, the cellular layer of the periosteum. It lines the nutrient foramina as they enter into the bone. It lines the inside of the bone and along the medullary cavity, and it also lines the trabeculi of spongy bone. So basically, long story short, wherever you find bone's surface exposed to something else, you're going to find a layer of endosteum. Spongy or cancellous bone is called that because it looks spongy. If you cut through the epiphysis of a bone, like right here, you would find it has this very spongy and red appearance to it. I'll use the term spongy bone. It's just as descriptive as anything else, and it's really commonly used. Cancellous bone is probably, strictly speaking, the better term between the two. I'll accept either one. So it's a honeycombed inner layer that fills completely flat, small, and irregular bones. Remember that also, or should be short, sorry. Flat, short, and irregular bones. Remember that sesamoid bones are a subcategory of short bones. All sesamoid bones are short bones, but not all short bones are sesamoid bones. So in this list, we're automatically including sesamoid bones. So it fills those bones completely. Those bones do not have yellow marrow. And it also fills the epiphyses of long bones. They feature trabeculi, which you've seen before. There's those arches that make up the bony part of that spongy appearance. And they're filled with red marrow overwhelmingly. You may find some bits of yellow marrow in small quantities, but overwhelmingly it is red marrow. Red bone marrow is hematopoietic. Hematopoietic, meaning it makes blood cells. Hemato, referring to blood, poietic, referring to creation. I think that's from Greek. So these are your bone stem cell, or your blood stem cells. You make your blood from the inside of your bones. If you've ever heard of somebody donating bone marrow for a transplant, they can do it from stem cells in your blood now, just in your bloodstream. But before, what they would have to do is they'd have to take this big honking needle and pierce your ileum and suck out the red marrow from the inside of your ileum directly. Because that's where your blood stem cells are made. And so if you need a bone marrow transplant, or if you have leukemia and you need a transplant so that you can replenish those cells, and not cancerous versions of those cells, you need to harvest that bone marrow. Infants, interestingly, only have red marrow when they're first born. So if this was an infant bone, in here would be filled with red marrow, in here would be filled with red marrow, just like adults, and in here would also be filled with red marrow. And if you think about it, that makes a lot of sense. Like on one hand, you kind of want kids to have some fat on them, that extra reserves, so that if they experience some amount of famine, they have a little extra to live off of. But really, their number one job is to grow, right? The more active cells have to be, the more nutrition they need, the more waste they create that they need to have swept away. And so the more access to the bloodstream they're going to have. The more your blood is getting used, the more you're going to have to replenish that blood being used. Same thing with your white blood cells. You're going to start making a lot of white blood cells. They're primarily made in your bones. Some of them mature elsewhere, and that's where you'll hear like T cells or after the thymus. That's not where they're made, it's where they mature. But to accommodate all that growth, the entire middle of all of the bones in an infant's body are red marrow. And as they get older, that marrow in the medullary cavity of their long bones will slowly, mostly convert to yellow marrow, to fat. There's still some red marrow we all have, particularly hugging the walls of the medullary cavity, but it's overwhelmingly yellow marrow. And that's an important fat reserve for our bodies, so that we can, if we didn't have enough subcutaneous fat to harvest, we could potentially harvest from there. You have spongy bone filling the middle, as I mentioned, of short, irregular, and flat bones. They have no medullary cavity. They're just spongy bone filled with red marrow and compact bone on the outside, and periosteum surrounding that. We've touched on this already, but to reiterate, you've found by now I like to repeat myself a lot in these slides. If it doesn't sink in one, maybe it'll sink in another one. Two main types of marrow, yellow marrow and red marrow. Yellow marrow is called yellow marrow because it is fatty. It is filled with white adipose connective tissue. It's called white adipose because in a microscope slide, a super thin layer of that will look white, but in a gross perspective, like a surgical perspective, fat looks bright, beautiful buttercup yellow. It's like the sunshine with the surgical lights beaming down on it. And it's because fat has this yellow appearance when you're just plain old looking at it, it's called yellow marrow. Red marrow is hematopoietic. It makes blood cells. Infant skeletons only have red marrow because they're growing so fast. You also have within the marrow, within red marrow, stromal support cells. So these are additional cells that you're going to find in bones that are not really bone tissue per se, but are accessories to bone life and bone function. So for example, macrophages, which are a type of immune cell. Bones can get infected. They are living tissue, so they could get infected. So you're going to need macrophages. You're going to need some sort of a scout, immune system scout hanging around to look for invaders. Fibroblasts, you have a dense irregular connective tissue in the periosteum that's making, so you're going to have fibroblasts there, as all dense irregular connective tissue has. You have collagen fibers that are being laid down, those perforating or Sharpie's fibers that are connecting it to the bone. And you have collagen being secreted inside of the bone itself. And while a lot of that is being created by the bone cells themselves, fibroblasts are also doing some of that work. Hematopoietic stem cells make your blood cells. That includes your leukocytes, which are, what are those? White blood cells. Your erythrocytes, which are your red blood cells. You need to use these terms on exams. Not white blood cell, red blood cell, please. Platelets, which are actually cell fragments of a cell called a megakaryocyte. So really your hematopoietic stem cells are making megakaryocytes that will later fragment into platelets. All of your immune cells are made in the bone marrow, specifically the red bone marrow, but some do mature elsewhere. So for example, like I said, your T cells, your T memory cells, your lymphocytes, mature are in your thymus. So they're made in your bones, they travel to the thymus, they mature there, and then they can do their job, excuse me, within the body. Your bone marrow has a barrier between itself and the blood. So you've probably heard of the blood-brain barrier, so that things that are in the blood that aren't helpful to your brain don't actually get into your brain, but your brain has access to the rest of the blood supply. Your bones have also this same type of barrier. You feature special receptors on the capillaries within the bones that hematopoietic stem cells can cross, mature blood cells can cross, but the immature blood cells will stay inside of the marrow. So you have this selective movement of cells across this bone marrow blood barrier. It also goes a long way towards preventing infectious or towards pathogens from entering the bone tissue itself. Once you're inside the bone tissue and past the periosteum, infections that settle in tend to be very hard to fight. You also have a really limited space for inflammation and swelling, and so when you have a little bit of swelling inside of a kind of a bony encasement, it hurts like hell, and it does a lot of excuse me, it does a lot of damage. So you really want to take pains as a organism to prevent infections from setting in your bones. You do, however, of course, want to make sure that those stem cells, those blood cells that you're making, you want them to get out into the blood, so you do have to give a certain type of permission for those to cross, and regular blood cells too, because you do need to feed those bone cells in the meantime. Long bones, as we've mentioned, are made up of the diaphysis, the shaft of the bone, and the epiphysis, the ends of the bone. In adults, these are functionally fused at the epiphyseal plate, right in here. It's between the diaphysis and the epiphysis. Your diaphysis has overwhelmingly yellow marrow, and it has a medullary cavity, a big open space where all that yellow marrow fills. And your epiphyses are mainly filled with spongy bone, which are in turn filled with red marrow, those hematopoietic stem cells. In between this epiphyseal plate is basically a scar left over from when you were growing. If you think back to the picture of that fetal skeleton, there was a lot of cartilage, right? Cartilage is what your whole fetal skeleton is made of first, and then it ossifies, and then it turns to bone. As you grow, particularly taller, your cartilage will grow, and then it'll fill in with bone. And then it'll grow some more, and then it'll fill in with bone. And then it'll grow some more, and it'll fill in with bone. And ultimately, at the end, what you'll have after you're done growing is this plate that finally fills in with the last sort of spurt of bone tissue, and it looks different from the other bone. So that's your epiphyseal plate. Interestingly, your yellow marrow can convert to red marrow if you need it. So remember, infants had only red marrow because they're growing so much. If you, for some reason, needed to heal at extremely fast rates, your body is capable of converting that yellow marrow space into red marrow space to help facilitate your own growth and healing as well. This is our last slide. Again, the bulgy end of the long bones are your epiphyses. Some of your flat bones also have a long appearance, but because they don't have an epiphysis and because they don't have a medullary cavity filled with yellow marrow, they are not considered to be long bones. I'm thinking mostly about the ribs. Students will often call them long bones. They're actually flat bones. Your outer shell of compact bone houses spongy bone in the epiphysis. And then on the epiphysis is where you have the parts of your bone that intersect with other bones, right? Those are the parts that intersect with joints. You can't just have bone rubbing on bone because then you'd have your connective tissue rubbing on connective tissue, and you're going to wear down that compact bone. You move all of your joints an awful lot. So you'll line the superficial aspect and the most proximal and distal aspects of the epiphyses of your bones with a layer of articular cartilage. Articular cartilage is overwhelmingly hyaline cartilage. I should actually specify that. It's not overwhelmingly, it's all hyaline cartilage. This does contain in the epiphysis some red marrow. It's most abundant in your humerus and your femur because those are your biggest long bones, but you do have it in the epiphyses of your other long bones as well.